Hello, fabulous fur friends and their humans. Welcome back to Paws and Purrs. We're incredibly grateful for your unwavering support as we share in the journey of caring for our beloved pets. Today, we're shifting our focus to an important topic that's often overlooked. We're talking about a condition that affects our four-legged friends, particularly dogs. It's called Wobbler Syndrome. Today, we delve into a condition that affects our canine companions, Wobbler Syndrome. So, what exactly is Wobbler Syndrome? A question that might cross your mind if you've encountered this term before, perhaps in a conversation with a veterinarian or while researching about dog health issues. Wobbler syndrome, also known as cervical spondylomyelopathy, is a disease that affects the spine within the neck region of our canine companions. It's a condition that's as peculiar as its name, causing the afflicted dogs to have a distinctive, wobbly gait, hence the name. This condition primarily affects the cervical spine. That's the part of the spine located in the neck. It's a result of compression in this area, which happens when the vertebrae, the small bones that make up the spine, don't form correctly. This abnormal formation leads to a narrowing of the spinal canal, where the spinal cord and its nerves reside. Picture this. Imagine a garden hose with water flowing freely through it. Now suppose someone steps on that hose, causing a kink. The water flow is disrupted, right? Similarly, the kink in the spine disrupts the flow of signals from the brain to the rest of the body. This disruption can lead to a range of symptoms in dogs. Most prominently, it results in that wobbly walk we mentioned earlier. Dogs with Wobbler syndrome might have difficulty walking, seem unsteady on their feet, or even fall over at times. It's a bit like watching a puppy learning to walk for the first time. But in this case, it's a symptom of a serious health issue. Interestingly, Wobbler syndrome is more common in larger breeds of dogs, such as Doberman Pinschers and Great Danes. However, it can affect dogs of all sizes and breeds. It's not a respecter of breed or size, making it a condition that every dog owner should be aware of. So there you have it. That's Wobbler syndrome, a condition that might seem strange but is quite serious. It's a disease that affects the communication highway of the body, the spine. And when the spine is in trouble, it can lead to a host of problems that go far beyond a wobbly walk. You may wonder, how does Wobbler syndrome affect our furry friends? Well, let's delve into that. Wobbler syndrome, also known as cervical spondylomyelopathy, is a condition that affects a dog's spinal cord and vertebrae in the neck. Its name comes from the distinctive wobbly walk dogs with this condition often exhibit. But it's not just a shaky gait that our canine companions experience with this syndrome. One of the first signs of Wobbler syndrome is neck pain. Dogs might whine or whimper, especially when their neck is touched or moved. They might also hold their head low, reluctant to move it more than necessary. This is because Wobbler syndrome can cause the spinal cord and nerve roots to become compressed, which can be quite painful. Along with neck pain, dogs with Wobbler syndrome often show signs of weakness, especially in their hind legs. You might notice your dog stumbling, tripping, or even falling down. Over time, this can progress to partial or even complete paralysis. Wobbler syndrome doesn't just affect a dog's physical abilities, though. It can also impact their overall quality of life. Dogs with this condition might become less active or show less interest in play. They might struggle with tasks they used to find easy, like climbing stairs or jumping into the car. They may even have trouble eating or drinking if the condition becomes severe. One important thing to note is that Wobbler syndrome is more common in larger breed dogs. Breeds like Doberman Pinschers, Great Danes, and Bernese Mountain Dogs are particularly susceptible, but that doesn't mean smaller breeds can't develop the condition. It's crucial to keep an eye out for the signs, no matter what size your dog is. Wobbler syndrome can significantly impact a dog's life, but with early detection, there's hope. It's essential to consult with a vet if you notice any signs of Wobbler syndrome in your dog. The earlier the condition is diagnosed, the better the chances of managing it effectively and maintaining your dog's quality of life. So while Wobbler syndrome can present some serious challenges, it's not an automatic death sentence. With the right care and treatment, dogs with this condition can lead happy, fulfilling lives. In our next scene, we'll go over how vets diagnose and treat Wobbler syndrome, so stay tuned. Knowledge is power, and the more you know, the better equipped you'll be to help your dog should they ever face this syndrome. Wobbler syndrome can significantly impact a dog's life, but with early detection, there's hope. How do veterinarians diagnose and treat Wobbler syndrome? This is a common question on many dog owners' minds when they first learn about this condition. In the diagnosis process, the veterinarian will typically start with a comprehensive physical examination. They'll assess the dog's overall health and pay particular attention to the neck and spine. They'll observe the dog's gait, looking for any signs of instability or abnormal movement. If the vet suspects Wobbler syndrome, they'll likely recommend some additional diagnostic tests. These might include X-rays, which can help to identify any abnormalities in the spinal column, such as narrowed vertebral canals or offset vertebrae. Another test that is often used is magnetic resonance imaging, or MRI. This provides a more detailed image of the dog's spine and can help to pinpoint the exact location and severity of the compression on the spinal cord. Now let's move on to the treatment options. There's no one-size-fits-all solution for Wobbler syndrome, and the best course of action will depend on various factors, including the dog's age, overall health, and the severity of the condition. One possible treatment is medication. Non-steroidal anti-inflammatory drugs, or NSAIDs, can help to reduce inflammation and alleviate some of the dog's discomfort. Steroids may also be used in some cases, though they come with their own potential side effects and should be used cautiously under the supervision of a vet. In more severe cases, surgery may be recommended. There are several different surgical procedures that can be used to treat Wobbler syndrome, all with the goal of relieving the pressure on the spinal cord. These surgeries can be complex and carry some risks, so it's important to discuss the pros and cons with your vet. Physiotherapy is another treatment option that can be beneficial for dogs with Wobbler syndrome. A canine physiotherapist can provide exercises to help strengthen the dog's muscles and improve their balance and coordination. This can be particularly helpful in managing the condition and improving the dog's quality of life. Regardless of the treatment plan, professional veterinary care is crucial. Wobbler syndrome is a serious condition that can significantly impact a dog's life, and it's not something that should be managed without the guidance of a vet. Regular checkups and monitoring are important to ensure that the treatment is working and to adjust the plan as needed. So, to sum up, the diagnosis of Wobbler syndrome involves a thorough physical examination and a series of diagnostic tests, while the treatment can include medication, surgery, and physiotherapy. Remember, if your dog shows any signs of Wobbler syndrome, consult a veterinarian immediately. The sooner the condition is diagnosed, the better the chances of managing it effectively and giving your dog the best possible quality of life. A Wobbler syndrome is a complex condition, but together, we can tackle it. It's crucial to remember that this syndrome is a spinal issue that primarily affects large and giant breed dogs, but no dog is entirely immune. It can lead to a wobbly, uncoordinated gait, hence the name Wobbler syndrome. We've discussed how this condition can affect our furry friends, causing symptoms like neck pain, difficulty walking, and in severe cases, paralysis. It's heartbreaking to see our beloved pets in discomfort, but the silver lining is that Wobbler syndrome is diagnosable and treatable. The importance of early detection cannot be overstated. A prompt diagnosis can make a world of difference in your dog's quality of life. Various diagnostic tools, including X-rays, MRIs, and CT scans, can help identify this syndrome, followed by treatments ranging from medication to surgery. Remember, it's not a death sentence. Many dogs with Wobbler syndrome continue to live happy, fulfilling lives with the right treatment and care. So let's not lose hope. Instead, let's strive to understand our pets better and be vigilant about their health. Before we wrap up, don't forget to subscribe to Paws and Purrs and hit the bell icon for notifications. You'll be the first to know about our latest videos on pet health, training tips, and more. Thanks for joining us today, and keep those tails wagging.